So how do I get from the short axis view at the base of the heart to the remaining short axis views? First, let's go back to the short axis view of the aorta. I would now tilt the transducer more apically, but still stay in a perpendicular orientation to the original long axis of the left ventricle. So the original long axis is oriented in this direction. I would now tilt the transducer exactly perpendicular. When I tilt the transducer, I will gradually lose the aortic valve, but I will see a new structure appearing. The structure down here is the inferior vena cava. Finally, I would arise at the mitral valve, and the mitral valve would then be the structure you see here with the anterior leaflet, the posterior leaflet. This is the LVOT, the outflow tract, and this would be the septum. If I tilt further down, I would leave the mitral valve, but I would still see structures, but these structures are not the valve, but they are the tendinae, which are attached to the papillary muscles. So all these little structures here. Then I would move further down, and all of a sudden I would see the papillary muscles. Those are these structures here. And I would also see the right ventricle with the moderator band right up here. Okay, this is the moderator band. And if I want to go even further apically, I will have a problem, because I will have to tilt the transducer even more, and I will then lose contact with the skin. So there's a little trick you can use. All you have to do is just move down one intercostal space, and all of a sudden you get a nice view of the more apical segments of the left ventricle. And you can even go down another intercostal space and get the supraapical regions, at least in some patients.